two major health insurance providers, one crucial decision. Which one is truly the better fit for you? On one side, we have UnitedHealthcare, famous for its nationwide coverage. And on the other, Molina Healthcare, known for affordable plans and focused care. Let's put the advertising aside and look at how these companies really compare. We'll break down key categories and award points so you'll know exactly who comes out on top. The results could surprise you. So here's what we're gonna cover. We're talking premiums and affordability, network coverage, plan offerings, member experience, financial strength and stability, digital health and extras, and one that often gets overlooked, community focus. You ready? Let's dive in one by one. Alright, first up, premiums and affordability. UnitedHealthcare honestly gives you a ton of options to fit a bunch of different budgets, but here's the thing. They usually end up being on the pricier side, especially if you're not getting help through a government program. Now, Molina kind of does the opposite. Super affordable, especially if you qualify for Medicaid or want a subsidized plan through the marketplace. The copays, minimal, out of pocket, way less stressful. The only catch? You don't get as many choices depending on where you live, but for most people chasing affordability, Molina wins this round. Let's talk network coverage, because who wants to hunt for a doctor, right? UnitedHealthcare is just massive, like biggest provider network in the country, kind of massive. Big hospitals, top specialists, you name it. The only downside? If you wander out of network, your wallet might feel it. Molina, on the other hand, is kind of like that reliable local spot. Strong networks but a bit more limited, usually focused in certain regions or states. If you need broad coverage pretty much anywhere, UHC's got your back and honestly takes the cake here. Moving on to plan offerings. UnitedHealthcare's menu is wild: Medicare Advantage, employer coverage, individual insurance, Medicaid, even short-term plans, and some juicy extras for dental, vision, all that stuff. Molina's really dialed in on Medicaid, CHIP, ACA marketplace, and some special needs stuff. Not a ton of employer-based plans though, so if you want custom combos, UHC is kind of the clear winner. Oh, and here's something cool you might not know. Medicaid, it's actually covering over 80 million Americans right now, and insurers like Molina basically live and breathe these kinds of programs. Now, for member experience. Okay, UnitedHealthcare shines big in tech, mobile app, digital tools, customer service anytime you need it. And it's a big but sometimes it feels like you're dealing with a giant robot. Some folks say it's just too impersonal. Molina is different. They want you to feel like you're more than a number, especially in those community programs, and people rate them above average for Medicaid satisfaction. The trade-off? Their tech is catching up but not quite there. Still, if you want that neighborly vibe, Molina edges ahead. Let's get a little businessy for a second. Financial strength and stability. UnitedHealthcare, it's like the heavyweight champ of insurance. Massive, sturdy, and with resources for days. Ratings are up there too. Molina. Growing strong and solid for its size, but more at the mercy of how Medicaid pays. So if you want a company so stable it's practically boring, UHC wins this one. Okay, digital health and extras time. UnitedHealthcare pulls out all the stops: telehealth, sleek wellness programs, digital tools, the works. It's honestly a little overwhelming how much tech they throw in there, but if you like clicking around your health plan, it's a dream. Molina has made a bunch of progress and their telemedicine is expanding, but it's just not as decked out. UHC takes the crown here too. Last comparison, community focus. UHC is so big that it can make an impact nationally, but local, it's a little, not super warm and fuzzy. Molina though. They partner with local groups, run culturally smart programs, and really work with underserved folks where it counts. If you think community matters, Molina is the hero here. Looking at all those categories on a radar chart, you can really see the differences. UnitedHealthcare dominates on network, financial strength, and tech. Molina steals the show for affordability and community impact. It's a pretty interesting split. So listen, here's how I see it. If you want a massive network, love digital tools, and want access to every kind of plan under the sun, UnitedHealthcare just wins in those departments. But if you're looking for a Medicaid or subsidized plan, or you want to actually feel seen in your own community, Molina's got some seriously strong appeal. If this insurance comparison helped you think things through, make sure to catch our next health plan showdown. You never know what fine print we'll dig up next time.